Hey, what's up everybody? This is your nutritionist on the go, Singh Aujla from Erudite Nutrition, and I'm back with another video. We are going to discuss about milk. Okay, drinking milk and eating milk products when it comes to diabetes. Okay, all the people who are diabetic, you guys can drink dairy, eat dairy products. There is no such limitations except for the amount of dairy that you are going to eat in one particular sitting. Okay, see, first of all, dairy products are a good source of protein. Okay, these are good for you. Even if you're a vegetarian or a non-vegetarian, dairy products are always good for protein, not for calcium. Again, this is off the topic, but do not take your milk for calcium. Always take your milk as a protein meal. Okay, it is good in protein. Now, when it comes to quantity, I want you guys to be restricting yourself on milk quantity. See, if you are a diabetic, okay, have smaller amounts of dairy. Okay, if you're going to have curd, have about 100 grams of curd, not more than that. If you are going to drink a glass of milk, I suggest don't drink a glass of milk that is of 200 or 250 ml or more. Rather go for a cup of milk which ranges from about 120 ml to 150 ml. Okay, at that particular quantity, you are pretty much safe from the lactose sugar that is present in the milk. Okay, now milk contains sugar, it's called lactose. We have to be careful with lactose. Okay, whatever drink you want to try, you can drink lassi, you can have curd, you can have yogurt. Make sure you're not getting that supermarket yogurt which is added sugar. Okay, which has added sugar in it. That will certainly harm our blood glucose levels. We are totally going to avoid it. You can make your yogurt at home. Okay, you can make your flavored curd or flavored yogurt at home. So you can get the recipes from internet. It is filled with such recipes. Okay, what is the correct time of drinking a milk? I suggest either you drink a cup of milk before your meal, maintain a gap of about 45 minutes, or maintain a gap of 1 hour after your meal. The logic is simple. You have had a meal, you must have had something that has low or medium or high carbohydrates. You are already giving your body enough energy, so just relax and take your milk after an hour. That's easy because milk has sugars. Okay, we have established that benchmark. Which type of milk should you choose? See, first of all, there are two variants, either it's cow or buffalo. The buffalo milk is higher on fats. The cow milk has lower in fats, but the cow milk has more amount of vitamin A. Vitamin A is great for us. Okay, vitamin A is great for our skin. Vitamin A is great for our eyes. So you can choose between the availability as you like, but I prefer you guys go for the cow milk. Now coming up to further disintegration and categorization, we've got high fat, the standard, that is 4.5 percentage of fat, and then we have skim milk, that is 1.5 percentage of fat, and at last we have almost, which has the least amount of fat, that is 0.5% of fat only. Now see, the amount of fat that you are going to reduce from your milk, the carbohydrates will increase as per proportion. Not actually increasing, but as per proportion. When the fat is removed from a product, the remaining products, they increase in ratio. Okay, so we have established the fact that fats do not disrupt our blood glucose levels, but carbohydrate does. So when you are going to take a lean milk, okay, a milk which does not have much fats in it, or when you remove the malai from top of your cup, you are basically discarding the fats that are in that milk cup. So I suggest you do not do that. Now, there is a small disclaimer. You are a diabetic alone. You have no other health issues. You are perfectly fit. Your only and only health complication is diabetes. I suggest you go for a full fat milk. It is much better for your body. It will be more easier on your blood glucose levels. But if you are a diabetic and you have some kidney issues, or you have some heart issues, or any other medical complications, any other health issues, you go for skim milk. Okay, so this is an exception. If you have only diabetes, no other health complications, go for the higher fat milks. That will help your blood sugar levels. So guys, talking about other dairy products which are higher in fat, such as cheese and paneer, it is mostly safe for you guys because cheese and paneer actually have a very low amount of lactose, that is the sugar, that is the carbohydrate which is in the milk. So they are very much safe for your consumption. Now, if you are going to have paneer with a roti or with white rice, that is not going to help you in any way. Okay, that will in fact destroy everything that you have worked for in your whole day. So if you want to have a little cheese, if you want to have a little bit of paneer, you can have, that is a good source of protein, that is a good source of fats. Try avoiding cereals with high fat foods, with high fat dairy. Okay, the best thing is go for paneer salads. Okay, or you can use cheese in your salad, in your vegetables. Okay, try avoiding other products that are high in carbohydrates. So guys, the talk of milk will always be incomplete until and unless I mention the national drink of India, that is chai. Okay, the doodh patti chai, the milk tea. One of the worst thing that you can do to your body if you are a diabetic patient is to drink a cup of chai. Okay, chai, the combination of tea leaves and milk, is actually inflammatory, poisonous, anti-nutritious, and it will always disrupt your blood glucose level. If you guys don't believe me, I have proved this over and over again with many of my clients and my patients. They have shown drastic improvement in fasting blood glucose levels once they quit drinking chai. You can have a cup of milk extra instead, or you can go for black tea. But do not mix your milk with the black tea. So now if you are skeptical of my statement, okay, try quitting the chai for 7 days and monitor your blood glucose levels for the 7 days. Okay, DM me if you get another results that by avoiding chai you must have spiked your blood glucose level or whatsoever. DM me if you get such kind of results. Okay, we'll talk about that. But I am sure, 99% sure, by quitting the 1 or 2 cup of chai, the milk tea, the chai, you will certainly reduce your fasting glucose levels and drastically help your body recover from all that stress. There is this just one small request that I want to make you guys when it comes to dairy and dairy products. See, dairy is good. Dairy is good in diabetes. We have already established this fact. I don't want you guys to overdo on dairy. Okay? If it is a good product, do not overconsume your dairy products. Okay? So which means whenever you are going to have a meal, whenever you are going to have your breakfast, lunch or dinner, just have a look at the glass and your plate and all your ingredients. I request there should only be one product that is made from dairy. Okay, now it can either be a glass of lassi, either be a cup of milk, or either be a little bit of paneer, cheese in your vegetables, or a little bit of curd. Do not overdo your dairy products. Okay, don't make such mistakes like you are having a paneer sabzi, you are taking curd along with it, and you have also kept a glass of milk or a glass of lassi by your side. Excess consumption of dairy will certainly harm you. Okay, so consume it, keep it in a moderate quantity. So same goes for all the time. See, the best thing is if you can put a 1 hour gap between your meal and if you want to drink milk or lassi. But even if you don't have time, if you have to drink or have a glass of lassi or milk along with your meal, make sure you are taking no other milk product along with that meal. So have dairy, but don't overdo on dairy. Diabetes, I suggest drink a high fat milk, drink it guilt-free, and you can have lassi, you can have chaj, you can have curd, raita in whatever form. You can have a little bit of paneer and cheeses also. So drink milk with a restriction, drink it in cups, don't drink it in glasses. Have a proper portion size for all these things. Okay, I'll see you guys next time, and stay tuned and take care of yourselves.